You're up for another interesting conversation. As October marks Breast Cancer Awareness Month, early detection of the condition can lead to effective treatment and a positive prognosis. Almost 90% of patients survive for many years after diagnosis when breast cancer is detected at the early stages. Regular self-breast examination and regular mammograms are key to early detection. Well, let's take this conversation further with Dr Sarah Nietz, specialist breast surgeon at the Breast Imaging Society of South Africa. Dr Nietz, thanks for your time this afternoon. Would you explain, please, the significance of Breast Cancer Awareness Month and its impact on raising awareness about breast cancer in South Africa?
Thank you, and thank you for having me. Breast cancer is the most common cancer among women worldwide and in women in South Africa. And certainly rates of breast cancer have been increasing. So every year it's important for us to remind everyone about how important it is to be aware of the early signs of breast cancer and to seek help early when any changes are detected.
Well, I'd like us to look at the causes of breast cancer. I mean, it's alarming that it is the most common cancer, I think you mentioned, and the fact that the numbers keep rising all the time. What are the causes of breast cancer?
So we can't really pinpoint it to one single thing, unfortunately, but certainly we know about risk factors. First of all, anyone can develop breast cancer, even men, but the two most the most important risk factors are being a woman, so gender, and increasing age. Other risk factors include a personal history of breast cancer, so women who've had breast cancer are much more likely to develop another breast cancer, or women who have people in their family, and especially close family members who have had breast cancer. I think the most important conversation today is really about the modifiable risk factors, so lifestyle factors that we see, because I think this is where we're seeing the shift in terms of the increasing numbers. And certainly obesity is a big factor. So women who are overweight or obese have a much higher risk of breast cancer. And we've seen this in our own data at Chris Hani Baragwanath Academic Hospital, where over 50% of women presenting with breast cancer were either overweight or obese. Other lifestyle factors are a sedentary lifestyle, so a lack of exercise. Another increase in risk is referred by excessive alcohol intake, again something that we see quite commonly in our society, and also what we eat. So certainly we found that women who have a higher concentration of fatty foods are more likely to develop breast cancer.
Are men immune to breast cancer, Dr. Nietz?
No, unfortunately not. So in my practice, I'll see about one man for every 100 women. So it's much rarer, but still it certainly can occur.
Well, one way of dealing with breast cancer, or certainly the possibility of it, is early detection, which is crucial in improving breast cancer survival rates. Share some insights, will you, into the importance of early detection and the role it plays in breast cancer treatment outcomes?
Yeah, so as you said, survival is definitely linked to stage at presentation. The earlier women come, the more likely there will be successful treatment. And even with the more aggressive subtypes, we certainly can see much better outcomes when women come at stage 1 or 2 versus stage 3 or 4. In terms of what we can do to present early, I think awareness is the first part, and then all women have access to clinical or to breast self-examination, and we would certainly recommend also mammography and ultrasound for women over the age of 40.
Now, there are a number of misconceptions around breast cancer. What have you encountered in your practice?
I think one of the most common ones, it won't be me. So I often see women who are young, who have had a lump, but just felt that it would be unlikely for them to have breast cancer. And unfortunately, oftentimes here treatment is delayed because the diagnosis is made so late. Also, certain population groups that feel they won't be affected. But the truth really is breast cancer can affect anyone and at any age.
Now, the Pink Month initiative is one of those initiatives that creates a huge amount of awareness and certainly does a lot in dealing with breast cancer awareness. Speak to us more specifically about its impact on dealing with breast cancer, dissemination of information and so on.
Well, I think the more we can reach people to be aware, the more likely women are to come forward. I think one thing is to provide an access and awareness. The other thing when we talk about breast cancer is to just bring out the message that really treatment has improved so much and that women shouldn't be afraid to come forward if they find something.
Now, one of the biggest challenges around breast cancer or any cancer is the emotional side, right? So let's talk about, what sort of emotions do women particularly or anybody with breast cancer, what emotions do they go through? And how can those at home support their partners, parents, and so on?
That's really an excellent question. Breast cancer is a disease that affects the whole family. I often find that, the whole family will be affected by this. Specifically for women, I think that we often are also mothers, so we care for children. The impact of the diagnosis doesn't only bring fear to our livelihood, but we obviously always worry about those that we care for. Women are obviously the center point of families and often breadwinners in the South African society as well. So this can impact whole family structures. In terms of what we can do, I think practical help is probably the most helpful. Asking how can I help, providing meals, providing emotional support, and just being there and, offering maybe to take the kids to school or easy things that anyone could do would be the most helpful for the majority of my patients.
Dr. Nietz, I'd like you at this point to speak to those individuals out there that might have breast cancer or are survivors of breast cancer. I mean, words of encouragement are obviously critical. The lay individual may not know what to say. In fact, you may go on and say the very wrong thing to say because you just don't know how to deal with a particular situation.
Yeah, that's quite right. So I think from my point of view, what I can say is that the earlier women come, the better. Certainly our treatments have become more structured and more personalized, and we're seeing more and more good outcomes in women. As you said in the beginning, over 90% of women successfully survive and live with this disease. For the layperson out there, the best word of encouragement, I think, is to say, I'll be there and walk this journey with you. And I think that is the most honest and appropriate what you can do as a friend or a family member.
Dr. Nietz, you're a specialist. Now, can you share some insights into the advancements in breast cancer research and treatment? I'd imagine when you started out in your profession to where you are now, there's been much improvement.
Certainly. And I mean, these improvements really go across the board, from earlier detection, better and more sensitive imaging modalities. We're finding more and more ways to subclassify breast cancers, to target treatments, and to look for specific mutations that we can use for personalized therapies. As a surgeon, I can say that the vast majority of women can nowadays be treated with breast-conserving options, which means that we preserve the aesthetic contour of the breast and preserve the breast. And even when we have to do mastectomies, it's very rare for us to do the more radical mastectomies that many patients still have in mind, but we use very small incisions, and we mostly are able to preserve the entire skin envelope and, for instance, the nipple. So I think all these things really move forward in preserving not only the health of the patient, but also their spiritual and mental well-being.
Final question, Dr. Nietz, and that's around any activities around breast cancer awareness that are taking place during the month of October that you might be aware of, that those of us who would like to support can go ahead and support.
I think there are many walks that are available, any way to get involved in the community and to join the awareness. So I would just say to everyone, get out there and join, and please know your breasts and do go for mammograms or self-breast examinations of whatever you have available.
Dr. Nietz, it's been lovely speaking to you. That was Dr. Sarah Nietz, a specialist of breast surgeon, Breast Imaging Society of South Africa. And we were talking about Breast Cancer Awareness Month in the month of October.